Qhsc.
So good morning, everybody. Thank you
Good
for
morning.
coming on Saturday. We're going to try to make it as fast as we can, but hopefully answer a lot of questions because we're getting to that time that we need to put everything in writings. And so the behind the scene, a lot of preparation has been done. So we're at the point that now we can definitely start getting tickets for people who are traveling, of course, getting tickets for the gala. We're getting the groups together to try and start setting up all this preparation. And I just want to say thank you for everybody who is working behind the scene, volunteer their time to try and make all this Qhsc activity a success, because without you guys, we are not going to be here. So thank you. And if I forget again, thank you. Today is March 21st, 2026, and right now is 9:07, and I don't want to take too much of your time unless if somebody has any questions, we can start the meeting. Any questions, something that we need to include when the meeting? No? Okay, so let me put on my screen here. Okay, so I did something. They've changed so many things, these Zoom people, but anyway, yes, again, March 21st today. It is a beautiful Saturday, so we can start discussing. So the agenda, as I said, is just, some of them is just a reminder so we know where we are. Definitely general members' contribution, end of the month, especially the leaders, and then everybody else. I mean, as soon as you contribute your annual membership, then we get the little card. Online training, we're still doing them. We started with the school, so we're gonna start doing some of the training. I think the one that they're working on right now is about the stroke management, and then GI, like all those gastrointestinal issues. And then we have the CPR, they're still working behind the scenes. So once we have the set date, we share with everybody. And then for community, of course, we're still going on with cross ministry. We're still waiting to confirm some of the church's engagement. And then so we can do those community CPR as needed. Definitely, we need people to continue working on the fundraising and stuff. As I said, that's why we put all those groups in the Qhsc group so we can start working behind the scene. And then, of course, our second gala is coming. And the theme, we see continue the Enchanted Safari for 2026. The date is 12/12/26, and the same time 6 p.m. to 11. So there's some people who are already going to be in the group. We're going to set it up, and then you're going to get the notification when you guys can start meeting. And then, of course, the biggest discussion today is about the medical mission, which is going to be on the September 11th, 2026. September 11th, 2026 up to September 26th, 2026. So we are working on the securing the spots for the flights, visa, and the Tanzania logistic. We're going to discuss more information now. So yes, just a reminder for the cross ministry is this Thursday, the 26th. So if you can and you're available, please come and join us between 5 to 7. It's only 2 hours. We usually try to do as much as we can. And last time we be able to pack almost 240 bags. So those are the bags that go and help those people who have food insecurity and in our communities. So anybody who can help, that would be great. Let me know. Or let Bree know so that you're coming so we can put you on the schedule. So we will be able to have a record that you attended this one. Some of the training, including the stroke, the first one was the Minazini and Palm Beach County School. So this was a collaboration between the two schools, and it was done on the February 18. And there was a total of 38 people. So that was great. The teachers in Tanzania, I think there were like 14 of them, and then including the teachers here and some of the board members and the members of Qhsc, they were able to attend. I think I lost my slides. Hold on a second. It came and blocked my screen. Okay. Fundraising. Definitely, we do need some support. Double good groups. They're still communicating, and we're going to set it up to try and help and try to do at least three fundraising for the year. We try to do probably 3 months apart. And the reason we're asking people to join the Double Good fundraising is you don't have to do like go anywhere else to start selling things physically. No, we're just asking you to share with your network. So let's say if we get 7 people and doing Double Goods, it's great because we're going to get reach more people in individual networks. That helps us to raise money. And also advantage for this one is because people get the popcorn. So at least they're getting something instead of just giving the money or donating the money. So we do need more people in this group. So then when we start sending those reminders or the link for them to order the popcorn, it will help us raise money as fast as we can. And this one can be done with wherever you are in the country. And we're going to walk you through with that part. As I said, last year was Sister Rukia and my husband worked together behind the scene. They were able to set it up. So it's already set up right now. It's just to say which day we can do. And sometimes they give us 4 or 5 days to do it. So please, if you can, as I said, you don't have to do anything else other than just sharing the prepared link, the prepared advertisement. You just share to your own group of people, and then they order, and automatically QHSC get half of it. Amazon, yes, we're going to try to continue sharing those links so we can people can buy, because some people say I don't want to give you money, I just want to buy the item, which is fine. Then we can show them on the website, and they will go there and select like baby clothes, toothbrush, toothpaste, all those stuff. Definitely. We do still work with churches, so if the church, one of your church wants to support us, definitely let us know. We can share those letters, the IRS letters and tax deductible letters and Florida state letters. We can share with the churches so they get credit for supporting us. And then, of course, we are asking for more support of if you have a family member, the organization or your workplace that you work there, if you can share word with them and help us raise funds. Like for example, for the HCA, it does. We have matching fund. We have donation, like monthly donation. You can say, okay, I'm giving $10 every month. HCA will match it, so QHSC will get $20, and then they disperse that money every quarter. Also, they have HCA have like volunteer hours. So if you're attending to the meeting like now today, or you come to do for cross ministry, or you get anything that you can do in your community for volunteer work, you can you submit on that website, and then it gives if you submit up to 20 hours, then the organization get $1,000. So these are the regular things that you are doing now with your community or activity. But as long as you have that program in your workplace, and then you submit those hours, you get QHSC get out, because you have to identify it. I've already done the application behind the scene, and then you have the information. So if you have the same thing that your work can do, just let me know. I will give you all the information. Usually they need the EIN number, the tax deductible letter from the IRS. And then because the organization is registered, so as soon as they put the EIN number, our organization is going to pop up to your account on your workplace, and then the money comes automatic. You don't have to worry about, oh, let me mail the check, or how am I going to do it? You don't have to worry about it because everything is registered, and the organization will cut the check and send it to us. It's already set behind the scene. We still also encourage, if you know anybody with a restaurant to do fundraising, definitely we'll be happy to work with you. So behind the scene to get those application and stuff done, and then we'll show up to go and eat. Social media, of course, we're going to continue asking you guys to share our word out there, so we'll be able to get those posting and get those donations from you guys. Remember, just encourage people, whatever they donate is 100% tax deductible. So because the organization is a nonprofit, everything that they donate and say, let's say, I want to donate, this goes to the medical mission. The money will go to the medical mission no matter what, even if we need something else, because we always try to honor what the people are offering or they're instructing us where their money is. And as I said, some people wants to say, I'm actually buying the stuff. What do you need? Yes, we need school supplies. We need the baby clothes. We need CPR training mannequins. So all those things, sometimes people wants to know where their money is going. Just let me know. We give you the list of all the stuff. Or if you go to the website, it's listed there. So they can say, okay, I want to be able to contribute towards the mannequin for CPR. I want to contribute towards the newborn clothing, diapers, and all that stuff. Or I want to contribute towards the toothbrush or toothpaste or the notebook for the students. So they can do that part because we want to make sure that people are giving where they want the money to go. And then so we make sure they do. And then usually some people want pictures afterward. We take pictures and give the people so that we see where their money went. And we're happy to do that. Okay, so the biggest part for the discussion today, as I said, is the medical mission, September 11 to 26, and then registration. So I think there are 3 or 4 people already put the deposit down. Thank you for doing that. So now we're kind of come like take off and try to get things going. There's so many things that I need to go over with you, but also you will get this email with the information so you can have something in front of you to be able to walk yourself through it. So again, all the registration, all the payment is going to go through Zephy because that's why we are trying to do that. And then you get immediate receipt for what you are giving out. So then you can use the receipt for whatever you want, just to make sure that all that money is going direct to the organization. So we do have our flyers, and definitely, yes, we're going to Tanzania. And this theme of this medical mission is called the Safari of Service. I said again, the time is September 11 to 26, and we'll be going to Tanzania, Dar es Salaam, that's the city. We're going to be excursions. It's going to include going to Zanzibar, and then Zanzibar, we have the town historical activities. We're going to go to the market. We're going to get your spices and a little few surprises included in there. So you'll see when you get there. So typically we leave here at on the 11th. Some people will leave on the 12th, maybe early in the morning, depends on where you're coming from. So, and then we arrive on the 13th, so which is, thus believe is Sunday. So Sunday, when we get there, we unpack and get situated in our hotel or wherever the accommodations are. Then Monday we start working. So Monday, Tuesday, Wednesday, Thursday, we work in the hospital or the school for 4 days straight. So then Friday, Saturday, Sunday, those the excursions part. So we travel to go to Zanzibar. There's a few things, like, again, people who have been to Zanzibar before that we know. And then Sunday evening, or we're going to go back to Dar es Salaam. And then Monday, Tuesday, Wednesday, again, and Thursday, we're going back again to work either at the hospital or at the school. You get the schedule, so you don't have to worry about, oh, where am I going to go? No, you will know before we leave. By the time we leave, you have a schedule exactly where you're going to be. I mean, there's sometimes the little changes here and there. Maybe before, instead of going to school today, go and help in the hospital because we have a bigger group to train. So we need the extra hands. Yes, you might do that. Or sometimes the school, somebody from the hospital wants, we schedule to go to the school to go and help do screening. Then yes, we can move you around. But as I said, we do this in the evening, every evening before the next day. We go over what we did that day, and then we say who is going to be doing the next day. We're going to have leaders in each group. So then those are the ones who are going to say, okay, at school tomorrow, we're going to do A, B, C, D. At the hospital, we're going to do this and this and this. At least to give you an idea. We know something can change. We all know that part, but we're going to try to stick on the schedule so we can make sure everybody goes where they're supposed to go, and all the activity that have been scheduled, that will happen. So this is a picture. I mean, I said some people did not know what these pictures for. This was like all the volunteers. We were there to go to see the school, and that's the time. I think there was a day before we left. We went to the school and see the school and did all the trainings, CPR training, sanitary pad distribution. So all the volunteer helped to do that and work with the kids. That's the picture from last 2024. Okay, so for the medical mission, of course, most of the time people wants to know how much it costs. So we try to keep the expenses less than 33,000 for the previous five missions. But we know expenses have risen up, the tickets goes up. So now we know we are trying still to keep it less than 3,500. And remember the variable thing here, the biggest variable here we have is always the flights. So the flights we can say range between 1,300 to 1,700. Because remember, we don't know where you are going, how many connection you do, and what time you bought the ticket. So since we started talking in January, the prices were very, very low. Unfortunately, there's a war somewhere. So that affect where we were passing through, and of course affected the airlines. So, some of the flights have to be rerouted and all the stuff. So it kind of affected the flights prices. And then so the agents told me a couple of days, I think it was yesterday, he said the price is creeping up a little bit higher than what we expected before. So we need to get the ticket sooner than later. So we are still working. I did ask him to try and find also other airlines to try and make sure how comparable is between those airlines, including to Emirates and Qatar. So, because we always like Emirates. Emirates is always the best for our comfort level because it's a long trip. So we try to make it as accommodating as we can. But some airlines, yes, they might be cheaper, but the accommodation might not be the greatest, like food or space in there. Because remember, you're going to be on the flight almost 27 to 35 hours. So you really want to be a little bit more roomy to be able to rest and stretch your legs. And of course, the food should be good instead of just worried about only the price. So we update you as much as I can when I get the information. Okay, so for the Tanzanian logistic, that part stays, it cannot go more than 1,800. We already try to manage those prices that way. And of course, we still need to confirm and lock down those prices so it doesn't change. But at least for that one, yes, it's going to cover all the accommodation, food, travels, and cultural experiences. So the only thing that once you pay the 1,800 for Tanzanian logistic, and then you get your ticket, visa, and medication, whatever is left now is going to be for like shopping and do whatever you want to do, and that is going to be on your own expenses. Sorry, one more. Once you decide to join the trip, we're going to encourage you to include the family member into the Qhsc group because we want them to know that if you are awake, if you are sleeping, everything is okay, what experience you're going through. We kind of like want them to live through us while we are there. The reason I'm asking you to include their family member, once you confirm and everything is before we leave or towards the end of the preparation, we want them to know what is happening. Remember, Tanzania is 7 hours. It's going to be 7 hours when we are there. 7 hours ahead of compared to US. So sometimes the people think, okay, they are during the day, let me try to contact the family member over there and find out you don't answer for the next 7 hours. They think something bad happened. So we want to make sure that when we are awake, we'll be posting in the group so that we see, okay, now they're awake. Now they're going here. Now they're doing this. Now they're eating lunch. They're eating dinner. They're eating whatever. Oh, now they're teaching. So we want them to see the experience as we do it so they know ours. Okay, so let's say if they text you and maybe you don't have a connection or your phone is not allowing you, because sometimes it happens because of the network, at least they will see everybody else is in the group. They might see your picture in the group, so they'll be like, oh, my family member is okay. And all in all, we always say, I will give you my number. My husband is going to give you his number. So to say, if they cannot communicate with you directly, they can ask us, and then we say, okay, that person is okay, that person is. And if there's any emergency, we reach towards them privately as quick as we can to make sure that everything is settled. But yeah, so being in the group, at least it will reassure them to see you guys are okay, doing what. And then so if after the medical mission they want to leave, that's okay. It's fine with me. But I just want during the medical mission, I want them to see what is happening so then to reduce that anxiety, because I know some of the people who will be going to Tanzania, maybe they've never gone outside of the state or outside the country or outside the continent. we want to make sure the family member are living through you, so the experience is for the whole family. Um, again, the tickets when we were talking about when we started this in January was like for example, people from Miami, it was like 1,300, almost like 1,400. So now when we were asking like yesterday, it was like 1,600. So we do need to get those tickets quick before the price gets higher. I know before with the Texas, Wellington, and stuff, it was 1,300. So I asked him to confirm. So he's working on it. People who are coming from JFK, people who are coming from other states. So I gave him a list of states so then he can figure out what is going to be the next one. The voucher was from the January estimation. So he's going to still continue check and make sure if we still getting the vouchers. So that means the voucher is like he can lower the price to that amount if it's there. Because right now we missed that window. Now he has to make work with the different prices. So we're gonna keep you updated. And the more accurate information it will be, that time you want to buy a ticket, that's the time we know for sure. Because remember the prices for the flights, we can't hold. I can't say okay, hold the 20 tickets down because I don't know if I'm gonna get 20 people. I cannot say hold the third and then I might end up maybe with only 20. So unless people maybe like gave the money like at the end of the year before that, then I will say definitely I need 15 in January. Then it will be a confirmed amount of the price. So right now we don't have that much, but so he's working because he knows it's a group. So once he said, okay, the first person start buying the ticket, he can say give 72 hours or whatever for this group so they can buy the ticket at that moment prices. Okay, so there's a lot of information that we do need to go over it. And of course, the best thing is, as I said, the confirmation. We just received the letter from Wananyamala, which they gave an invitation for us to go and do the medical mission. Okay,
Yes.
perfect. Okay, so this is the letter from United Republic of Tanzania, Minister of Health. So that's why they gave us the permission to go now to Tanzania and work with them. So this usually is the initial because we didn't want to start buying tickets and stuff and find out that we can't go because they didn't give us permission because we can't get visa without this letter. So this is the letter now. We're excited that we just received like 10 days ago, and that's why we moving along. So every volunteer we get this letter when we are doing the visa. But don't worry about that. But we're going to walk you through step by step to make sure that you get all the information you need. Okay, so that is the letter. The information here, right? So this is a document that all volunteers are going to get it. Once you, I know few people have already sent the deposit. So I am going to send the whole, I wanted to talk about it before just forward you the this long message. But it says their objective over there to Tanzania is to volunteer and provide medical and nursing care to patients and community around the Dar es Salaam to improve health education on health preventative measures and individual care of the patients and community and the school children, to encourage patients and the community to assume an active role in improving individual health practices and behavior. And another one is to increase nursing and medical clinical education to improve clinical competence. In turn, we improve patient health and safety. So that is the objective for the mission, because we're trying to empower either the children or people at the hospital, the patients, or even the healthcare workers to actually take a little extra step for things that we can share with them to make sure that they do what they need to do. Thank you. Okay, so we already said the objective now. Okay, so I'm going to go through this document so people will understand what exactly is in there. So preparation for the one hospital, that's what I told you guys, the Mwananyamala. So we need to confirm the volunteers' names by May 30th. And then, of course, the credentials. So that means the behind the scene, we're going to make sure you are, like all your passport information and stuff, because they need to know when you're going to get the visa, it's going to be your passport number, your full name, the way it appears on your passport, and also the invitation letter. So all those things, as soon as you start submitting those stuff, we start communicate on the side. And then your passport should not be expired. So if you need to get your passport right now, renew it as fast as you can. When you're doing the visa, we want to make sure the visa is still $100. we want to make sure prepare those 2x2, two passport size. More likely you're going to send with one, but always get the second one, because when we get to Tanzania, just in case if maybe they can't see, they might say we need your passport size. So always take those passport size. CVS, all this drugstore, you can be able to get those passport size. Invitation letter, we do have that one, and then we have the online preparation for application. So that one I can show you in a minute. I just want to finish this document because I can see today has been kicking me out all the time. So yes, there's a specific portal to apply for the visa, and this is an official website. Then we're going to walk you through step by step. On this page, put this information, so we walk you don't have to worry. And we're using, of course, the official Tanzanian electronic visa part. You don't have to pay this other person because we can work with them. So we've done this so many times. And then, of course, another thing that should be prepared now is immunization. Definitely, because you're going either to be in the hospital and stuff like that. And of course, you're going to see the children. We want to make sure you have received hepatitis A. So hepatitis A also is for the food. Because remember, we're going to try to go to eat on the safe places. We want to make sure the people who are preparing our food are competent. That's why I'm going to tell you, sometimes we go around and people are like, oh, I want to buy that in the street. I'm like, no, you can't do that because I don't want you to get sick. I know it looks so appealing and enticing. We go to the beach, I want to buy. No, 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 no. There's a specific place I've already vetted those people, and then we eat as a group. We buy food kind of catered for us to make sure we don't eat anything that maybe was not washed properly. We don't eat raw food because I don't know where it was prepared. If I know that people need that, we go to the restaurant somewhere we know for sure people are competent to prepare our food. So don't get discouraged when I say don't eat that. We can't eat that. We need to eat in safer places. But yeah, so tetanus booster. So those things more like your provider will work with you. The part that I'm encouraging you definitely to do is the hepatitis A and then the anti-malaria prophylactic. So majority of the doctors here may not know this tropical medication. So we do use CDC, which there's the link, I'm going to give it to you. You can take, and usually we have a little screenshot. So for you to take it to your provider and say, these are the recommendation from the CDC if I'm traveling to Tanzania. What immunization should I get? What the dose should I get? And then your physician is going to combine with what your medical, if you have any medication you're taking, what is going to be safer for you. So for example, for for anti-malaria, I usually take the mefloquine. But there's some people who cannot take that. This is the pill once a week, which I like. I don't like to take medication. But there's some people you can take daily, which for me, it makes me sick. But for other people, they're okay with that part. So your physician is going to be the last person to say, yes, take this and take that. And as I said, the CDC have recommended so many of them. So you will have an option to do that part. Yeah, the doxycycline, we take it that daily. And then we used to say the COVID vaccines, some people have not had them and they're okay. That is take your ownership, full responsibility. This document was prepared even when we had COVID, so that time you could not travel without the COVID vaccine. So if you have it, just make sure you keep on it with you all the dates to make sure if you need to present. I'm going to confirm by the time we get close to if they're asking for the COVID vaccine or not. If not, that's okay. Or if you cannot get the COVID vaccine and you have the letter saying you can't, that's okay. Just put it, save it for yourself. So, and this is the one usually I said we send you the little copy of this, and then your physician is going to make the recommendation. We usually also take the Cipro or Augmentin because of urinary tract infection. Remember, it's dry here. People can be dehydrated, whatever it is. We just try, if you have those symptoms, then you take that, but kind of like a prophylactic. We want to make sure if you get sick, you have your medication. I know those some of the medication or generic medication might be in Tanzania, but we always want to make sure you take something that to help you to take and not worry about going to the pharmacy in the middle of the night. Anti-diarrhea, definitely, because remember, you are drinking different water. You're not used to it. You might not be used to certain spices. So we do take Cipro or Fragile or whatever your doctor wants to order for you. Then you can do that. anti-nausea medication. So sometimes people get the Zofran. Sometimes your doctor may give you a different one. So these are the just things to help you to have a conversation with your doctor. So then your doctor can say, take this, not this one, that one. That also helps. We're going to go through ferry or the boat to Zanzibar. So some people have motion sickness. So if you have your anti-nausea medication or motion sickness medication, take it with you. Definitely that will help because I don't know how you're going to react. So that's why we have kind of general things in this. So far for the last 5 medical missions have worked for people. Majority of the people never even use any medication for the prevention of urinary tract infection or diarrhea because they were there safely and they came back safely. That's fine. But I know a couple of people got sick, and then there were other things also they were sick from. So this also helped them to make sure that they have something with them. And usually we are blessed enough, we have some physicians or doctors with us or nurse practitioner with us. So kind of like we get some support, and then they can guide us to where to go. And we usually work with the Mwananyamala, the hostel that we're going to. We work with those physicians. So if one of the volunteer is sick, we can consult with them, and then they'll be able to help us. Guiding us what for other medication in Tanzania that people needs to get. But as I said, so far we've been using all we get from US and we've not required it from them. So if you are able to get this medication, that would be great. Of course, when you go to Tanzania, majority of the patients and the children speak Swahili. So we always want you to have at least those little few words, you introduce yourself or something like that. We have that little program called Duolingo that also can walk you through to be able to learn those few phrases. Most of the time, we always put you with the person who is going to be translating for you to communicate what you are sharing with the people, either at the hospital or at the school. And then, of course, some of the people there do speak English, but also you'll be able to communicate with them as much as you can. And if there's any issues, of course, I'm phone call away. And we have Tanzanian healthcare workers who also speak English, so they can help us to manage those situations. And we have people who have gone there already, are going back, so then at least they can say, okay, with this, ask this person or call this person. And we are always, as I said, in the group. So if you need me to call you or just text me, find me here, and then we can communicate and be able to understand what your needs. So there's few ways of people usually start practice towards the end. As I said, we are working on it to try and finalize the airline as well as when he confirmed the airline, the prices, we can start getting tickets. That would be great. And as I said, fees for the airline, I can't control that. It's subject to change and availability at that moment. All our airlines flights, we try to get the ones that allow us to have two check-in bags. So usually you should have a personal bag, you should have the carry-on bags, and you should have 2 check-in bags. All those should be for free. The reason we are asking for free, especially those 2 check-in bags, is like, one, you can put your own stuff. The second one, we want to put the donation stuff. So because usually towards the end, people also still donating. By then you already send the big shipment, which we need to send by end of May. So it can get there 8 weeks to 10 weeks. You can get there before we get there. So we encourage you, when you get this your ticket, the second check-in free bag, we want to be able to put the donation stuff. Maybe not necessarily that you are adding that, but we might say, okay, so and so, where are you in? Let's say in New York or in Texas or wherever. I can order something in Amazon towards the end, and then you get it to deliver to you, and then you pack to that second suitcase. So that also help us to reduce the cost of shipping extra stuff. Because as I said, people are going to get started excited when they see you coming in and you're posting, okay, I'm going, blah, blah, blah. And they're like, oh, we're going to give you these donations. So we don't want to add more stress to you to say getting the third and fourth bag, and then you have to pay, because usually each bag is $250. So if you can help us to get the second bag, and then we put the donation items in there, that would be great, because at least that would be $250 used somewhere else that it can help. Traveling, we try to travel inside the country. as a group. Everything else is going to be done as a group. There's no say, oh, today I'm not going, I'm going to be shopping. No, we all go together. If it's the day for shopping, then we organize and you go with the transport with the group and you stay there as a group. And that's why usually as soon as you start getting those deposits, I have to go and deposit and lock in the transportation, lock in the hotel, lock in the meals, caters and stuff. All those things have to be paid now even before we get there. So, and that's why we say if you give that $250 and then later on change your mind and I've already counted you in there, that means I've already paid for your spot. It's non-refundable because I can't pay back if you pull away. However, if you pay that 250 and then you're going, it's going to be included into that 1800. So you're not going to pay more than that, but it's just only up to 1800 and that's it because everything else is going to be included. So when you are going there, we're going to try to get also travel medical insurance. So this one, as I said, I know I don't want to click it, it's going to kick me out. So when we do the travel insurance, we will give you the this link and then you select. This one is based on your flight and then the days that you're going to be there. So the idea is this travel insurance is going to cover if there's a change of the flights, if there's a delay, or if there's a lost baggage. Also, the best part I like is because they're going to cover when you are sick. So let's say something happens and you have to go to the hospital. It's going to cover the medical expenses. Something happens that they have to fly you back. It's going to cover the flight to come back. So you don't have to worry about, oh my goodness, what am I going to do if I get sick over there? How am I going to get back? No, this insurance is going to cover you to bring you back. So that's why we like to do that part. This insurance is different from your flight, the ticket insurance. The ticket insurance from the agents is going to cover only the ticket. So if you get sick, you're on your own, and we don't want that. So when you're buying the ticket, remember to tell him that I don't want the insurance. I want to get just the price for the ticket because this insurance that we are showing you is going to cover that of the flights and it's going to cover also the medical insurance when you are in Tanzania. So that's why, I mean, some people, I know there are a couple of people last time they bought both of them just to be extra cautious, which is fine. I mean, it's up to you. If you want to pay extra money, that's fine. Usually the flight insurance might be $100 or $129 something. And then the travel insurance, including the flight and medical insurance, majority of the time, I think the highest I've heard it was 150, which covers both places. Because remember, it goes to, based on your age, based on the ticket you're buying, and based on the days that you're going to be there. Because some people usually stays longer than the medical mission time. So all those things are going to be, there's some variation. It depends on what you're doing. But majority of the stuff have to be done as together. Okay, the currency. So yes, you have your US dollars. Usually it varies. So at the moment when I checked it yesterday, it was 25.60 shillings in Tanzania. We will get the time when you get to Tanzania with the airport, we will get the time to go and have your money exchange. Sometimes we do right there at the airport before we leave. Sometimes we do close to the hotel when you are staying. So, but you will get the time to do it. They do have ATM machines over there, but just be careful with the ATM machines because it has to be related to your bank so you don't pay fees. Some people usually clear with their bank there, so they kind of waive the international fees. You use your credit card or you use your bank tax, then you don't have to pay fee. But you have to talk to your bank here. Majority of the bank now knows international exchange, and they know. They will say, use this bank, use this bank, use that bank. And at the airport, there's so many banks. So more likely your bank here works with the bank, international bank. So then you don't have to worry about it. The same thing happens if we're in Dubai, some people wants to do shopping. Yeah, they do use the credit card, your credit card. Okay, for communication, definitely what I said is we're going to encourage you to include the family member to the WhatsApp so they know what is happening. The time you wake up, you go to sleep, what you eat, what you're enjoying life, what you're teaching, all those things, they will be able to see it through with you. And we have received a lot of good feedback that at least the family member are not worried. So they don't have to keep texting them or looking for them, but they'll just keep logging in there and they will see the updates continuous. But this group is like everybody who's gone to the medical mission can post in the group, whatever the videos and stuff like that. So just to have the family member know what is happening. electricity. So definitely be careful when you bring your phone, iPhone, iPad, and laptop and something like that. Just to make sure that you have that little converter. We usually share towards when we get like in May or June, we share the little adapter, so which you can know. Don't plug your stuff straight to the wall because you're gonna burn it. So we usually have the adapter so you can use that to protect your stuff. But as I said, we're gonna cover that when we start actually discussing what we're gonna be wearing. Accommodation, as I said, we all try to stay in one place. We usually stay in the hostel, but right now we kind of like upgrade, so we're gonna go and stay in a hotel, which is manageable for our range of the prices. And then so once we start getting more people to do it, then I have to reserve place and lock down the hotel and tell them that yes, we're gonna take those rooms. Um, Entertainment. So all these things, it depends on what we are doing. It's going to be included in $1,800 there. So if we need to go to a nice hotel so people can see how some of the hotels are in Tanzania, we are going as a group. So instead of maybe a meal in the hotel, we're going to be a meal in a restaurant somewhere. But those things, as I said, the last meeting before we go, you will see where we are going and stuff like that. Because by then we already confirm it and do the reservation. And then, of course, as I said, the 1,800 is going to cover the excursions and all the accommodations. And then you can have up to 500. Some people have used less than 500. Some people have not used any penny when they went there because they didn't want to buy anything, which is okay. Some people have used up to 500 buying the souvenir and stuff like that. That is all okay. But we're going to go shopping. We're going to do buying spices. If you want to bring home, that's fine. All those things is up to you. And as I said, we all do in a group. So things to pack. And then, we're going to review this. I'm just going to give you a little highlight. We're going to review this more in August because we want to make sure we are packing enough, but not too much. Usually, toiletries, definitely. We might go around places that they don't have toilet paper. So usually people have little wipes, and then people are going to share what they have. Tanzania is very hot. So we're gonna hopefully have the sunglasses. Definitely, we wear dressy long clothes to cover your skin because it's the in equator, so the heat is the direct sun. Some people have the hats, some people have the sunglasses, some people use the what do you call it, sunscreen. That's fine, whatever you need. We're gonna have a testimony of people who have been there to help you what exactly is in there. Extra batteries, definitely. If your phone, your charger use batteries. Definitely, some people charge their battery at night and then have something during the day. So all those things. Yeah. Sometimes in the hospital, some places might have you somewhere to charge, but you cannot rely on it because it depends on the unit you are in, and you might not get the place to charge. So we encourage people to have extra chargers. So during the day, if you need to communicate to your family member, that's okay. You have access to it. We already talked about the medication. As I said, we're going to explain a little bit more of this. You are going to get this document so you don't have to worry about it. Emergency communication, we already say that you're going to have your family member in our group. And of course, you're going to have my phone number and my husband's phone number to be able to have that connection if we have to call back your family members or communicating with them. That will be fine. And then, of course, this is more information. We get that part. We have Mwananyamala. As I said, the travel cash, sometimes this is from the feedback of people who have been there. Some people said approximately 350, some people up to 500. But you can change. Probably, I don't encourage you to change all of it when you're at the airport. No, don't do that because what happens if you don't use it, then you have to carry the money back. So we always have to encourage you just change enough. And then if you need to change it within before us going to Zanzibar, we are going through the port, we're going through the airport. Some hotels have ATM. You can change that, but that's fine. Instead of changing like all $500, because it's going to be a lot of money on your hand. And you don't want to be using a lot of cash and then you find out you don't need to, you can't use all of it. So in summary, for all this discussion, definitely get your passport now. Put that 250 deposit to hold your spot. And then when you're going to Zephyr, thanks for people who have already done this. There is a requirement required documents there. There's 4 documents there to HIPAA protections and do no harms and all that stuff, all those things. Once you put your name there, you get a copy of it with all that information. If you have any question, please let us know. The flights, as I said, the range is between 13 and 18. Until you buy the ticket, that's when you know the final price. Travel medical insurance, we're going to give you the link. And then invitation letter, we have the letter. And for the visa, we give you the attestation saying the organization support you as a member of the Global Volunteers to go to Tanzania with this permission. And then visit your physicians to be able to get your anti-malaria medication. People will share where they usually buy. Sometimes you can go to the travel agents, nurses. They will have those forms you fill out, and then they will give you the medication for Tanzania, because they said they're using the same CDC information. What you need to pack, definitely we try to wear scrubs, dark colors, because remember it's very dusty, hot and stuff. So we wear something long to even cover your legs. Some people who don't want to wear pants, they can wear long skirts. That's fine. No jeans. We are all going to be professional at any time. All the time is going to be picture taken representing QHSC. We're not wearing jeans. You can wear jeans if you're traveling to go to the excursions, that's fine, but not during the going to work environment or to school or to the hospital. We can't wear jeans, no. And then this is just the money that for Tanzanian logistic, what it covers, and then electricity, and then of course add the family to the group. And I think that's it. And if you didn't know where Tanzania is, that's where Tanzania, we're going to be right there in Dar es Salaam. We have been to Dodoma before, and of course, we're making arrangements to go to Arusha, maybe the next mission. But right now, we're going to go to Dar es Salaam, which is close to Zanzibar right there. So you'll be able to see all those things in Tanzania. And that is Tanzanian flag. Any questions? I know it's a lot of information. Any questions?
You're going to give us a copy of everything you went over, right? We
Yes.
Get that? Okay.
Yes.
I figured.
Yes, usually because if I give it, people get overwhelmed, and I'm like, no, let me explain first, and then I'm gonna give you back the give you actual document. Okay, so when you're in Tanzania, because I know people be like, okay, if I'm going, I don't know what I'm gonna be doing. Oh yes, we find something for you to do. So there's a groups of people, like they can do thermoregulation. That's working with the moms who are delivered, and then we have you go and talk to them and teach them how to bundle the baby up. Those group usually raise funds and get the little onesies, the blankets, the diaper, the little booties, the mittens for the little baby, and the little hat. So we buy those things, the bundle. So every baby who is born while we are there, we give them it, and then show mom how to do the blankets. So usually this is always challenging because like last time when we were there, we had, I think, 400 packets in a little bundle. So when we got the people who delivered the night before we arrive, we did not see them. We saw them from Caribbean deliver, and then we give them those little packets. Of course, they went and shared with the people who delivered yesterday. So the people who delivered yesterday, and remember, they're in a ward, everybody sees each other. And they said, oh, look what the QHSC gave us. So the people who delivered yesterday were not happy. They were like, where is that? So it's almost like 50 of them was given, because the hospital is big. They have so many delivery in a day. So we had to give them like 60 for the people who delivered the day before, C-section and vaginal delivery. So then, of course, on week day 6, we ran out of 400. So now when we show up the following Monday after the excursion, and then people are like, where's the blanket? Because they deliver now today. They were told they're going to get the blanket. So the idea is, if we are raising money to get those blankets, we need to get as much as we can, because we always run out. And it is so sad to go and see the babies and they said, but my baby did not get the blankets. And we are like, oops. But anyway, so another program is prevention of postpartum hemorrhage. So these are the people who have all the pads and stuff, go to the postpartum units and labor and deliver and work with these moms. CPR. So the CPR, a lot of people are going to be involved in the school and in the hospital. So as I said, all these things, you're going to be assign the group, and you will see and you will know it way before you get there. If there's a specific group like you really, really want to be in there, just let me know. But most of the time, we give the people according to their expertise and stuff like that. And then the non-healthcare workers, they go to those groups also to help, because even if, for example, for the CPR, even if you're not instructor, but you can help logistically, help us to set up and stuff like that. So everywhere you can be able to go and do stuff. Obstetric emergencies also. So this is people who we go and work with people in the emergency room, ICU, and all the stuff. Also, labor and delivery, C-section and stuff is included in there. Or SU is right there, of course. Anesthesia, the pre-op and post-op. So those is for the nurses. Those are for the CRNA. Those are the anesthesiologists. Everybody who can work in those areas. Yes. So we all know this part after people pay for their tickets and stuff. So then once you lock in, then we know which group needs to be included in our itinerary. For sports and magnet to all those non-healthcare workers, we go to their school and we'll be able to work with the activity that are done in school or go to the magnet. Hand washing and dental hygiene, this is almost everybody can do it. Reusable pads, let me see. Yeah, so the reusable pad, definitely everybody can do it. Usually the majority of the ladies will jump in there to try and work with them and teach the girls how to be clean and those things they need to do. And then nutrition and hydration, everybody can be involved to do the lessons, and also doing the water bottles, labeling and those stuff. All those things we usually do like a day before, and then go and do at school, finalize at school, get the student to help, which works very well. That means we have to have enough for everybody, because you can't give only this grade and not that grade. And then, of course, the school collaboration, people who have already been in school group, they know what exactly we need to do for those groups. And then we continue. Hopefully, we're going to try to host one collaboration between the Palm Beach County schools and the Minazini while we are there, so we can get more networking and stuff like that. Okay, so I know I spoke too long. I'm gonna stop that and then,
I have a question in reference to the travel.
yes.
These are not direct flights, correct?
No, they're not.
So where's this the first stopover?
So it depends on which airline we're gonna use. If we use Emirates, there's a Dubai, and then we go to Dar es Salaam. If we use Qatar, we go to Doha and then Dar es Salaam. If we use Turkish airline, we use Turkish sorry.
Okay, the reason why I asked
Yeah.
is because of the present state in the Middle East, and would
Yes.
that affect the stopover?
Yes, so I did speak to Nobel, and he said currently, when there was an issue in Dubai, the Emirates flights were rerouted and they were using another airport. Oh, the name I lost. There's another airport in the same country to go, or they can be rerouted to Doha and then go. So he said the airline knows already, even now, they are rerouting the flights from the usual stop over to another airport.
I had a question about the malaria medication. I had typed the name of the one that we took. Well, that I took when we went to South Africa. So I wanted to know if that was good, because that seemed to be the one that suited me best, considering every other medication I'm taking.
Yes, so the final person who's going to make that decision is your physician, because they will compare and see what it is. If you were able to take a medication to go to South Africa for the anti-malaria, that should be fine. But I think your doctor will be the final person to say yes.
Okay, yeah.
Mhm.
And I had asked your husband about the COVID-19, but he answered the question, because I don't take that.
Which is it was fine. So that this document was prepared when we were doing the first one, 2021 medical mission, where it was full force COVID.
Oh,
And that
okay.
time you could not fly unless you have a COVID vaccine. So that part is there. And then so usually
To
I
Africa, you couldn't
wait
fly to
for,
Africa because we flew to the Caribbean. I didn't have to take it. We just had to have the test.
okay. Okay, but
Okay.
yeah, right now, I mean, it used to be like you have to pay, you have to show COVID vaccine card before you can fly. But when we went to 2024, I don't think we had COVID. We didn't have to show anything at that time, and the airline stopped asking about the COVID vaccine because that time they can't let you pass from even Miami or any airport. You have to show the COVID testing and the results before you can fly. Yes. So right now, as I said, we just left it there just in case by the time we get there, are they asking for it? If not, then we don't have to worry about it. And I said, if you cannot take for whatever the reason is, that is okay. I mean, if they are asking, all we can do, we can ask them what is the person is going to do if they can't take that vaccine. But as I said, as of now, it's not mandatory to have, not to go to Tanzania. It's not.
Thank you.
You're welcome. Any other question? Katie, are you ready to go?
No,
I know.
but I'll support it all the way.
We appreciate you. And yeah, we always appreciate you. I know I've already seen your name somewhere in the group, so thank you. Yes.
Yeah, for the
Yes, I had a
gala.
question. I had a question about the safari. That's not in the excursion. That's something separate,
No, it's in the
or it?
surgeon.
Oh, it
The
is.
Zanzibar?
That's the safari, Zanzibar.
Yes.
Oh, okay. I thought that was the beach.
It is a beach.
Oh,
So
okay.
yeah, so we are using that term loosely because people usually thinking we're going safari is actually going to see the animals. But we are using safari. The word safari in Swahili is means it's the journey. So whatever you are doing, you are moving, vacation, all the stuff, you're going to safari. Like you
Okay, I
going
got it.
safari. So our Zanzibar fit that part that to be included in safari. So kind of like a little break vacation. So yeah, so Zanzibar is a beach. You're right, but there's a couple of things that we're gonna add to it to make it more interesting. But I know people love beaches, so which is great.
Yeah, we're beach people.
Yes. Oh yeah, you're gonna enjoy it. It's beautiful there. It's beautiful. I know Dr. Barker was asking.
Were the little knitted hats useful?
Yes. Oh, it was a hat. I mean, like people were fighting for it. Um, in 2022, we had the church from Minneapolis or Minnesota or somewhere. They had 1,000 knitted hat, and some of them
Oh,
were matching the little blankets. So we went and said, okay,
okay.
we ran
I'll
out
get
of
on my
them, and
job
instead,
and
huh?
I'll get on the job.
Yes, so when we did we distributed those ones and then we ran out, so we started giving the hospital, like the one with the stripes with the
Uh-huh.
little bandit hat. Oh, people are like, no, I want that one, the pink, the blue.
It shows love. That's what the difference is. I had a
Yes,
quick question. Before you
yes.
came on, we were talking about a restaurant, and I just wonder, is there any interest if it's like a $3 restaurant, like how much does it cost? It's not cheap, it's not super expensive, but it has like a jazz band, and I could talk to the owner if she would give us some like 10% of the people that we bring in and ask for donations. And there's a band break. Maybe you could talk about QHSC and bring a couple of posters so that they have with the QR code. Do you want to try that?
Yes, please.
Okay, we'll try that. I'll see.
Yeah.
I don't
And,
know. We'll see if she'll.
anywhere there's music, I'm there.
It's really good.
We can get Katie's instrument also, we can help them.
Yeah, Katie and I were talking about it. You can do the lyric, Katie.
Yes, it's
Okay. Oh,
any
gotta go.
other
Sorry.
question? No, that's
No,
fine.
yeah.
Oh, Kathy, can you share what you wrote down? Kathy? Oh, she's yeah. So she wrote here. when she went to Kenya in 2024, the easiest and most complete connection for travel medication was to make an appointment with your local health department. Oh, okay. So there we have the most up-to-date information via CDC and be able to recommend which medication vaccine you need. Yes, that's the same thing exactly. They try to do that maybe 2 months ahead, because sometimes some of the medication they have to order it, because here in the United States they don't use it, especially the anti-malaria medication. They have to order the medication, so do at least 2 months ahead, so they can order in time for you to start taking. Because some of the medication, like for example, I take the Lorium, you take at least a week before you travel, so you want to make sure you have that medication before you get that close. But I agree, a health department or travel agencies, they do, but I think sometimes the travel agencies might be a little bit expensive, but health department might be cheaper or even free, depends on what type of the services you have. So that's a good idea.
We
Yeah.
got
So
a few questions and statements in the group chat there.
I think somebody asked about the war, right? The war is in the Dubai, not in Tanzania. I think somebody said no war in Tanzania. Was somebody asking, is it Dan? Were you asking about the war in Tanzania, or you're talking about the one that is happening right now with those airports? Who is? I don't
Yeah, I
know.
think that's the one he's talking about. I'm not sure if he can speak. Oh, he said Dubai.
Oh, Dubai. Okay. Okay. Yeah. So that's the one we have been talking to the with the agency Nobel to try and give us an idea. Yeah. Thank you, Kathy. We'll see you at Cross Minutes. That's for sure. Okay. Any other questions? Then I can give you guys back your Saturday. Any other question? There will be a lot of discussion. Every month we usually have something that is happening. So especially like now, we are talking about it, and then if by the time it's the next month, people will have already bought the ticket. So we kind of now start talking about the visa processing and stuff, and what information we need to do. So that is usually in April, May. And then of course, May to June, we're talking about now the finalize the logistic in Tanzania, and then and shipping stuff. And then in July, we're talking about also finalizing the numbers, the what T-shirt we're going to be wearing for the medical mission, and what are the donation where we are. And then, of course, the last one is we share the schedule now. So all those, I said, 4 days here, 3 days here, we have the dates and all the names of the volunteers. We have your dates. So if you're in the hospital, your name is going to be in the certain part, and how many people you're going to be working with, who are the translators. And then usually we try to get them at least the final meeting before we leave. At least you can see the faces. And then who is going to be receiving us at the airport, how are we going to be traveling, and all the stuff. We try to do that, and usually we try to get like T-shirts for the Qhsc. If you travel with the T-shirts, so at least people, if let's say you get lost, people will be like, oh, I saw somebody with a T-shirt like yours. Passes over there, so we can find each other. But also, yeah, usually the organization have at least one T-shirt, so we can have those nice pictures for as a group. And sometimes the people buy their own extra T-shirt to try and get 2 or 3 T-shirts, and people wear the scrubs and then try to keep up. We have the badge, we have the tags, so we kind of like being official everywhere we go. Yes. But as I said, we're going to get more information. So this was just to give you a background of what exactly the expectation is. And then we share more information. But if we have any question, please ask in the group. So probably some people have not asked, but they're afraid to ask. Or just send me a message on the side, so then we can respond to that. Anything else? Miss Sarah, do you want to add anything?
No, not that I can think of. I think you covered everything there.
Okay. Let me see. I think is Dr. Park still there now?
No.
Jack and Jay, any questions?
No, I don't have any questions at this point.
Okay.
Nope,
Sister.
asked and answered.
Oh, and so you're saying Jerry now has the group, right? He's part of the group, or he has it back back active again.
Yeah, it's out of archives.
Okay.
Okay. Sister Rosalind and Sister Rukia, anything?
No questions. It's kind of really new to me.
I can't hear you. What did you say?
No questions. Can you hear
Oh,
me?
okay. Okay. Thank you. Sister
Yes,
Rukia?
mostly a review.
Thank you.
Grand Rising, everyone. I
Hi.
have I have no questions.
Okay.
I'm looking forward to being on the trade to follow you guys along. I'm excited about it.
Thank you. Yeah, it's gonna be exciting. Once we started doing a lot of stuff, but I know because some people are asking me on the side, oh, it's so quiet. I'm like, you have no idea. There's so many things going behind. When we start doing that, but then they will start seeing now, okay, things that happen. But yeah, it's always back and forth over there to try and make sure. Yeah. And as I said, we had a great meeting with the school. And the kids from Minazin have prepared a beautiful video we're going to share with everybody. And then the children from Palm Beach County here also prepared almost like what, 4 or 5 videos of the school and students. So we're going to start sharing those together so you can see what they're doing.
Stop! Don't
And
lick me, you
so
nasty
by the
dog.
time we get to the medical mission,
You
it's going
got
to
your sound
be
off.
too exciting.
Yes, I want to ask a question.
Yes, you have a question?
Yeah, I have a question.
Yes.
Um, all the paperwork and documentation that displayed today, will that be accessible on the
Yes.
site?
Yes, I will send you through the email. So that one,
Okay.
yeah, this one is different because I want you to have an actual copy with you. The other one is just so you have, because that's what you sign, so we don't have to have an extra paper. But yeah, so this one, the one I went through from the beginning to end, yes, you're gonna have a copy with it. Yes.
Okay, that's good. Thank you.
Yeah,
You're
and
welcome.
I'm sorry. I was just gonna say that last week my wife and I were excited. Something happened that had not happened prior to this, but we woke up one morning and we had realized that someone had purchased a ticket for the gala, and a few people had already started to purchase or made their payment for the medical mission. And the reason why that was good was because we were not the first ones to do it this time. Somebody else beat us to it.
That's good. That's good.
Yeah, usually, yeah, I know, honey, we always be like the first one instead of encouraging people, but people beat us to it, which is good, which is good. I like to be beaten that way, but so we can catch up.
I had a question. We're doing one shipment. You said by the end of May.
Yes.
Mhm.
So
I
that's
guess
why
we would.
yeah, so that's why I'm encouraging people. Yeah, we need to be a little bit more aggressive now. So to try and get as much things as we can. But this year, in fact, we're gonna have so many.
Well, unless she did it, our name is on the list to do some kind of surprise.
I'll do supplies. I don't think.
Fundraiser.
Oh, I didn't put it. Oh,
And his mic is open.
Yeah, so we're doing encourage people to raise funds and get those programs going so we can get those donations as fast as we can. Because this year, as I said, we have a lot of stuff to ship. And, as I said, things are happening in the world, so they might delay all those cargo transportation from wherever it is, because usually it takes 6 to 8 weeks. So if you count from September backwards, usually I don't count September at all because that's the travel time. So August and July, that means we need to ship it before in the beginning of June, sorry. The problem with that part, we have to get whatever we have and ship it to Maryland, and then Maryland have to pack it and whatever, and then ship it from there. So that's why we have to go back and make sure at least by end of May, we ship it to them so they have 2-3 weeks to pack it and repack and whatever they need to do, and then in mid of the July, ship it and receive it by mid of August, and then it has to be cleared by customs, and then it'll be delivered to where we are. At least now you give another 2-3 weeks because I don't know what is going on. And with all these things, so we have to prepare as early as we can. And that's why I said if we can do the bulk of shipment before the end of May, that would be great. And then wherever we get from May to end of August, then we can pack to the second suitcase. Because usually, sometimes I have like 15 bags. Because when people start getting excited and they see people are going, they're like, oh, I give you this much, which is great. I said, thank you. But then I'm like, oh, how are we going to ship it? But then, yes, sometimes people will do that. And then we also donate the money towards the shipping. Because on the flight, if you take an extra bag, it's $250 for a 50-pound bag. So we have been lucky so far. People will donate after the May 30th and also donate a little bit money toward the shipment. So we're always grateful for that because otherwise it's a lot of money. If you have 5 bags, that's already 1,250 just going for shipping, which it hurts because I would have rather used that 250, so 1,250 for something else versus just paying for shipping. But I said always God will provide. If people give me that time, maybe God is going to figure out for me to pay for it. So, but it's always, we are blessed. We've been blessed and we are thankful and appreciate everybody who has been supporting the organization for a while. So thank you, thank you, thank you. And then, did I see Melissa in here? Melissa?
Hello.
Hi,
Hi.
how are you?
I'm good. How are you?
I'm good. We probably have to catch you up later. We were discussing things that we need for the Qhsc.
Okay. I'll
Yeah,
catch up.
yes. Have you got your deposit yet?
I can have my deposit in no
I'm just teasing you. Anyway, if there's did you have any questions before we close? Because we're almost done. Did you have any
No,
question before?
I'll just catch up. I saw the volunteer list last night to sign up for, and I'm
Okay,
trying to decide which one to sign up for.
okay.
Yeah.
I know which one you should sign up for.
Which one should I sign up for?
You're a CPR instructor, of course, the
Oh,
CPR thing.
I'll sign up for CPR.
You do that every day at work, so I think you can volunteer your skills.
Okay. Volunteer those skills. That sounds good.
Yes. Also, you can do the double goods. That's just sharing the link once we set up the account.
Okay. I can do that.
Yeah. Okay, guys, I don't want to take so much of your time. Thank you so much for always representing and come to Qhsc meetings. Without you guys, we are not going to be able to do anything else. So thank you, thank you. I am going to give you back your Saturday, and then if you have any questions, let me know, ask in the group, send me a message, and then I will share this link when it's ready.
Sounds good. I'll see you Thursday.
Okay, yes, Thursday. Thank you so
All right,
much.
sounds
Yes.
good.
Everyone enjoy the
Okay.
weekend.
Okay,
Have a
bye,
good weekend.
everyone.
Bye-bye.
Have a good weekend, everyone. Bye.
Thank you too. Yeah, be blessed, everybody.